How should I phrase these, early childhood projects?
Yeah, other research programs.
Other research projects that involve, touch on early childhood.
Could you just give clap one more time? Great.
Still here?
Yep.
Okay. So a lot of our other early childhood work focuses in working directly with service agencies within the state of North Carolina to examine how new policies and procedures that they are implementing, how they may benefit and improve outcomes for children in the early childhood period. So for example, Project Launch is a collaboration between researchers here at our center and the Alamance County Department of Social Services, examining how a new system of care model that they are implementing to increase coordination and communication between service agencies, as well as the implementation of several new evidence-based early childhood programs. They're examining the extent to which that effort is implemented with high quality and the extent to which it produces long-term benefits for children and families. And we also have a couple of other projects at the center that are examining new policies within the child welfare services, back up and start again. We also have several other projects at the center that are examining new policies and procedures within child welfare services. So for examining, for example, how new policies within family drug courts for parents with substance abuse problems may reduce future instances of child abuse and neglect, as well as reduce rates of future child placements within the foster care system. And we also have another project that is working with the Department of Social Services here in Durham County to increase coordination and communication between DSS and mental health services to increase the rate at which children at risk receive mental health assessments in the early childhood period, and that they receive higher quality mental health assessments to try to identify children at risk for mental health problems from an early age, and to help get those children the services that they need to increase the likelihood of better long-term child outcomes.
Who's involved in those two that you just named?
So Christina Christopoulos is leading the work in Alamance County, and Dr. Katie Rosenbaum is leading the work with DSS to increase coordination with mental health services here in Durham.
And the drug court stuff, is that Beth Gifford?
That's Dr. Beth Gifford.
Okay.
Yeah, I just said poor Beth Gifford.
Okay. I think that's good.
Yeah, unless there are other questions or things you want me to touch on.
We're good.
That hit, I think, the points that Ken wanted.
Yeah.
I think the only thing he mentioned that I didn't touch on was the emphasis, the addressing gaps in services and knowledge, but I don't really think he's going to flip out about that. It's
Gaps in services and knowledge by whom?
the whole purpose or the primary goal of the early childhood group does evaluation and descriptive research with a particular emphasis on areas where there are existing gaps in services or knowledge gaps in factors that predict long-term child health and well-being. But I don't think that's like it's his, solving problems, doing cutting-edge research and intervention. But I think that hit on the points, at least that we came up with when we talked on Monday. So
Okay.
Great. Great.
And if he's not happy